Some people are quite rightly remembered and renowned in the history books for their lives and achievements. Many more, no less deserving, slip into the shadows of history and are forgotten. Many know that MacNeal Hospital had humble beginnings in a 10-room frame residence of Dr. Arthur MacNeal on the corner of Oak Park Avenue and 33rd Street. We're still at home in the same location, although we've done a tremendous amount of growing. In 1892, on learning of the need for a physician in the then pioneer community of Berwyn, Dr. MacNeal, a native of Michigan, came here to establish his medical practice after graduation from Rush Medical College in Chicago. Dr. MacNeal was a horse and buggy doctor in those days, visiting patients in their homes and in his office. Later on, Dr. MacNeal acquired one of the first electric autos to accommodate his many visits. In 1916, with surgeon Dr. Virgil Stevens as his partner, Dr. MacNeal opened an outpatient clinic in his Oak Park Avenue house after a local sanitarium was leveled by a fire. Steps towards organizing a hospital came on October 3, 1919, when 3 important people signed a legal document that allowed them to form a hospital. What some of you may not have heard is that one of those 3 founders was a nurse, Miss Elsie Reese. Doctors MacNeal and Stevens signed a contract with this nurse, forming the Berwyn Medical Unit. The Articles of Incorporation that they signed on that momentous day allowed the institution to carry on the practice of medicine and surgery, to own and maintain a hospital, to maintain a nurses' training school, and to develop laboratories for research work. Miss Elsie Reese became our founding nurse on that day, and nursing leadership was born. In 1921, this team converted the MacNeal residence into a 12-bed facility called the Berwyn Hospital. There were numerous expansions that occurred after the original 12-bed hospital was formed. It soon became evident that the converted residence was no longer able to serve adequately the lusty growing Berwyn of the early 20s. The first was in 1924, when a 3-story brick building was erected next to Dr. MacNeal's home. A 4th floor was added to that building in 1929 to make way for maternity patients to accommodate Berwyn's burgeoning population. With the opening of the maternity floor came the appointment of Amy Johnson, registered nurse, as obstetrical supervisor. Miss Johnson remained in that post until her retirement more than 35 years later. By 1929, our hospital employed 55 people, 17 of them nurses. Dr. MacNeal moved his family to another home in Berwyn, and his house next to the hospital was used as the nurses' residence. By the way, the person in the Chase Lounge out front, seen here, is our founder, Miss Elsie Reese. Shortly after this picture was taken, a MacNeal newsletter in November of 1929 states that Elsie retired to Tucson, Arizona. Growth soon came to a stop as tough times were approaching. Berwyn Hospital was almost forced to close its doors as the Depression brought a decline in patients able to pay for hospital care. Occupancy had dwindled to 10 patients. Faced with surmounting debts, the hospital was offered to sell for $50,000. Nobody could afford to buy it, so it was given away to the community. On March 28, 1931, Dr. MacNeal's hospital started anew as a community-supported institution. Upon the death of Dr. MacNeal at age 64, the debts were mostly absolved by the $50,000 life insurance policy he carried. The Berwyn Medical Unit, our hospital's original name in 1919, was named as the beneficiary of that policy. The Berwyn Beacon writes, "And all this will come into being because many years ago, a pioneer doctor with a great heart determined to build in Berwyn a hospital dedicated to true community service." By 1937, the hospital eased its way out of debt and more doctors joined the staff. The Berwyn newspaper reports that in 1937, Berwyn Hospital served 3,172 patients that year. It became one of the most modern institutions of its size in the state. In 1942, the hospital expanded again to 165 beds. In the spot that previously stood Dr. MacNeal's home, now stood an H-shaped hospital that Dr. MacNeal always envisioned, and it carried a new name, MacNeal Memorial Hospital. A donation in 1951 from the Ritchie V. Graham family made possible the construction of a nurse's residence. The words nurse residence are still carved into the archway over the door in what we now call the East Building. In 1955, the hospital grew again to a sizable capacity of 276 beds, and Zimmy, our night supervisor from 1923, one of our original nurse leaders, was the very first patient. The current North Building was built in 1964, adding yet another 194 beds, and MacNeal reached its present size of 429 beds. The South Building was the next and final large construction project to date, an investment of over $63 million in 1983. On February 1, 2000, MacNeal Hospital became a member of Vanguard Health Systems, and yet another chapter of MacNeal's history began. Through all of the changes over time for MacNeal Hospital, an article in the 1938 edition of the Berwyn Beacon says it best when it states, "Berwyn Hospital will carry on tomorrow as it has yesterday and today, the fine ideals, unselfish spirit, and community service of an outstanding citizen." We are stronger than ever since becoming part of Tenet Healthcare in 2013. As Tenet, we now have the scale and strength to fulfill Dr. MacNeal's vision to be a hospital with a heart, and in his words, dedicated to true community service. Ultimately, we have become a leading healthcare system that is innovative and forward-thinking, yet we remember our past, where the love of our community and our partnership in its health began.